Arizona has been ramping up coronavirus testing efforts, and that's a good thing considering we still rank 41st in the country in per capita testing. But the state still falls far short in its ability to follow up with contact tracing. ABC 15 investigator Melissa Blasius uncovering today our state's health department could need hundreds of more people to make that happen.
Think about how many people you come into contact with every day. Now, for 2 days, 3, 4, if you get coronavirus, any of those people could get sick and possibly die.
If you look at those places where they've been successful at really reducing death rates and the morbidity attached to the virus, places like Germany, for example, places like South Korea, it's all been the heavy emphasis on having a very aggressive contact tracing program.
Here's how contact tracing works. As soon as a health department learns of positive cases, a public health investigator should call the infected people and urge them to self-quarantine for 2 weeks, then collect a list of names and phone numbers of everyone they've had close contact with from home, work, and social activities. The investigator would then call all of those people and tell them to get tested and to quarantine their families regardless of symptoms. The investigator follows up, and if one of those people then gets sick, they restart the protocol with that person all over again. Contact tracing continues until you isolate all possible spreaders so the general public can return to normal.
Yeah, it's a little bit nerdy, but contact tracing just gives us the ability to find people immediately and in that 2-day window when they may be transmitting the virus and they don't know it yet.
So imagine what Maricopa County would go through in a day.
So 1,800 contacts a day.
But Maricopa County's health department says currently it has about 25 people actually making all of those contacts. Thursday, the County Board of Supervisors approved funding to hire 50 contract workers on top of 60 more full-time employees.
The public health department needs to ramp up its contact tracing staffing very, very quickly. This is a best practice and really necessary in order to support the reopening of businesses.
Last Monday, the state health director had promised even more help.
Implementing an enhanced state-level contact tracing that can expand to be up to 40 teams. So we are continuing to pilot that, and it will be in place by this Friday.
At ASU, the professors say their nursing students are able to assist in the effort if called upon because their estimates of the current number of Arizona contact tracers is far below what's needed.
Typically, a state our size, you'd want to have around 1,000 or 2,000 people playing a role in this.
I'm investigator Melissa Blasius, ABC 15, Arizona.